Bismillahirrahmanirrahim. I am Professor Rabab Kelany, Professor in Forensic Medicine and Clinical Toxicology, Department, Faculty of Medicine, Tanta University. Our lecture will be about physical injuries. These are the injuries caused by some physical agents. One of the physical injuries is called burns, which is due to some physical agents like flame. Another type of physical injuries is electrocution, which is caused by the electric current. A third one is called the heat injuries, which is caused by a very hot environment. So these are the intended learning outcomes: to define different types of burns, to diagnose physical injuries, to classify degrees of burns, to estimate the area of burn, to differentiate between ante-mortem and post-mortem burn, and finally to explain mechanisms of death due to burn. So let's start with the types of burns, and this is the first type of physical injuries, and we will classify burns into first one is the dry burn. Dry burn is mainly caused by flame. The second type is called scalds or moist burns, which is caused mainly by hot liquids. And the third type of burns is called corrosive burn or chemical burns, which is caused by chemicals when it is poured upon the body. So let's begin with the first type, which is called dry burn, and you can see here two causes for dry burn. The first one is flame, and the second one may be the hot metal, like this child touching the hot iron. So the content of dry burn lecture will be uh, Wilson classification of burn, rule of nines, factors affecting the burn gravity. How can you differentiate between ante-mortem and post-mortem burns, and the mechanisms of death in burns? Let's start with the first one, which is Wilson classification of burn. It will classify burn into 3 degrees according to the depth of destruction. Like we can see here, this section of the skin, we will see now the depth of destruction of the skin. This will classify burns into 3 degrees. So you can see here that the skin is classified into the first superficial layer, which is epidermis, and then we have the dermis, and lastly we can see the subcutaneous tissue. In the first degree of burn, according to Wilson classification, Wilson is a surgeon and he classifies burns into 3 degrees. The first degree is just a superficial destruction of the epidermal layer, like you can see here, and it is represented by erythema. That is due to vasodilatation of the capillaries present in the dermal layer. So you can see the first degree burn like erythema, and it will be painful also because this edema or this vasodilatation of capillaries will lead to stimulation of the nerve endings which are present here, and that is painful. And lastly, it can heal without scar formation. We will see scar next slide. So this is the erythema of the first degree burn, like the sunburn. So next degree is the second degree. You can see here that the second degree is deeper than the first degree. So here the destruction is destruction of the partial thickness of the skin, like the partial layer of the dermis is destructed, not all the layer, like you can see here. this is a normal layer, not destructive. So it is represented by erythema and blister. And it is also very painful because the nerve endings are stimulated, but it will heal with leaving a scar formation and disfigurement. So this is a blister which is full of liquid. This is a plasma fluid which is transformed from the blood into the superficial layer of the skin, and also it is surrounded by erythema. Wilson classifies or make a classification for the second degree into two uh, two degrees. The first one is the superficial partial thickness, and the second one is a deep partial thickness. So all of the second degree are called partial thickness destruction. One of them is superficial and the other one is deep, but both of them are blisters. But the first one, which is the superficial, is the blisters are thin-walled. So the walls of the blister are thin here, but are thick here. Here there is a little scarring risk, but in the deep one there is a great scarring risk because the skin is destructed more deeper, so the scar would be greater. Here in the superficial one, it heals within 2 to 3 weeks, but in the deeper one, it heals in 3 to 6 weeks. These are a photo for both of the two types of second degree, superficial partial thickness and deep partial thickness, and you can see the thin walls of the blister, or here you can watch the thick walls. This is an example for a scar which is left after the second degree burn, and it is must be replaced with a new skin in a plastic surgery operation. So we will have now the third degree burn according to Wilson classification, and here we can see full thickness destruction of the skin. That means that whole layers, both epidermis and full layer of dermis, are destructed, and this is called third degree. And we can see it clinically by a colorful lesion, either white, red, black, or maybe brown, like we will see now. These are examples for third degree burn: white, black, white, red, brown. Now let's move to the rule of nines, which is another tool to diagnose a burn. The first one, or the first tool, is Wilson classification of burn. So we have two tools to diagnose the burn. One of them to diagnose its depth, the second one to diagnose its width or extent. The rule of nines is used to estimate the area of damage by burn. So we are classifying the surface area of the body into nines, like you can see here. Here is 9% of the surface area. That means that the anterior part of one of the lower limbs forms 9% of the whole of the body. So 9% for the anterior part of the whole lower limb and 9% for the posterior. About the upper limb, the whole of the upper limb is 9%. That is 4.5 anterior and 4.5 posterior. About the trunk, there are 2 nines in the anterior and 2 nines in the posterior. The head involved 9% of the surface body area. That is 4.5 anterior and 4.5 posterior. So if we add all of these lines, we will have 99%. So the final 1% for the inguinal area. So what we will do about these lines, we will now measure or calculate the burned body area, because we must know that a larger area involved of the body, that means it is very dangerous to life, and 30 to 50% involvement for the body surface area may be incompatible with life. Let's see this one. Here are the classification about the anterior and the posterior, and here the trunk is divided into two lines, and the back also two lines, and the anterior part of the upper limb is 4.5. Anterior part of the lower limb is 9. Posterior is 9. And the head is 9% anterior posterior, and the inguinal area 1%. So we can classify the burns according to the rule of 9, or according to the extent of burn into major burn, which is more than 30% of the whole body surface area, moderate burn from 15 to 30%, and minor burns less than 15% extent of the body surface area. And here is a difference between the adult and the child about the rule of 9. You can see here that the head is larger in a child. It takes about 18% rather than 9% in an adult. Now we can have a slight or a small quiz. You can see here if these are the burned areas in a patient or in a living person. How can you calculate the extent of burn? Now we can answer this question. If this area, if the whole of the anterior part of the upper limb make 4.5, so this may be about 2%. And this can be 4.5% because all of this is 9. So 2 plus 4.5, it is 6.5. Now, what about this? The half of the anterior part of the trunk is 9. So this may be half of the half, and it may be 4.5. So that is about 11% or 10%. So this calculation of these burns may equal to about 10 to 11 or 12%. So it is a minor burn. Now let's move to factors affecting burn gravity. So we must mention what are the factors that the physician must put in his mind that are putting loads for burn gravity. So these are the 6 factors. The first and second, we have just finished them. So the first one is the degree. So when you are going deeply, it is more dangerous. Or we can also mention that the second degree is also more grave because it is very painful, while the third one is not painful because the nerve endings are already destructed. The extent, we have mentioned it in the rule of 9s. While we are studying rule of 9s, we have mentioned that there are major minor and moderate extent of burn. The site, you can put in your mind that if the site is in the head, for example, so it is more dangerous than if the burn is in the periphery. The age, the extremes of age all of the time are so dangerous because they have low immunity. Also, about the senile person or old person, they have dry tissues, and now we are going into some process called hemoconcentration, and that will lead to dehydration of the body and of the blood, um, because the plasma fluid is transformed from the blood into the vesicles or blisters of the second degree burn, and that will harm the body, especially if it is an old age which is already dehydrated. About sex, male or female can tolerate more the severe burn, which will lead to neurogenic shock and will transform into death. We can mention that female cannot tolerate this pain, so they will be transformed into neurogenic shock more rapid than male. But in other researches, they mention the opposite one. A male may be more vulnerable also to neurogenic shock or severe pain, and this is there is a debate about this area. The sixth factor is health. While a healthy person can tolerate more the complications and the severity of burn more than diseased one. Now we will answer this question. How can you differentiate between antemortem and postmortem burn? Antemortem burn is the burn that occurred in a living person during his life, while postmortem is a burn caused to a corpse or a deceased person or a dead person after his death. So we can use this table to differentiate between antemortem and postmortem. So first difference is erythema. Here we will find erythema is present in antemortem burn, because erythema, we just mentioned that erythema is due to a vasodilatation of capillaries, and this is a vital process occurred only during life. The vesicles, the presence of vesicles or blisters of the second degree burn, uh, it can be present in both of them, but some textbooks are talking about the vesicle content. So in antemortem burn, it is rich in albumin and chlorides and electrolyte, because, as we mentioned, they are transforming the plasma from the blood into the superficial or in these vesicles. So they are carrying all the constituents of plasma, while in postmortem there is no plasma transformed because he is dead, but we can find in some instances vesicles present in postmortem, and they are may be full of gases, which are gases of putrefaction. The third difference is hemoconcentration. Hemoconcentration is a process occurred after the vesicle formation for a large area. So vesicles which are covering a large burned area in a living body may lead to hemoconcentration, because the plasma is now present in large amounts in the surface of the body area, while The blood content is poor of plasma, so blood is now rich of blood cells and poor of plasma, and that will lead to a process called hemoconcentration, which is very dangerous, and it will lead to blood clotting and thrombus formation. This is present only in, of course, antemortem, because it is a process not occurring in the post-mortem. About the carboxyhemoglobin level, that is a key for this answer, for this question. So we can measure the carboxyhemoglobin level in the blood of this person to find the answer of this question. If we find it is high, so that means that this person was alive during the burn, and he was respiring carbon dioxide and carbon monoxide from the flame present around him, and so he is transforming his oxyhemoglobin into carboxyhemoglobin, so it is high. It is higher than 10%, while if he was dead and he is burned, so his carboxyhemoglobin level will be in the normal ranges, that is lower than 10% carboxyhemoglobin. You can also search about other causes of death. Of course, it will be not present in if he is burned alive during his life and it is antemortem, but it may post-mortem burn may conceal a crime, so you can find for example a stab wound, a firearm wound, a strangulation, so you can find other causes of death here in the post-mortem burned body. About soot formation, soot is the carbon particles which are present in the air passages. That means that he was alive during he was burned, so you can find them after autopsy. The forensic pathologist can make autopsy like this. While he was opening the larynx longitudinally, he find these soot particles in the larynx and in the trachea. That means that this person was alive during burn, and he is respiring these carbon particles, and they are for that is present in his airway. While in the post-mortem, no, he was not alive, so there is no soot in his larynx. But in some instances, in the antemortem burn, it is not present. While if this a criminal person was using gasoline, so that will lead to rapid fires, which will not take time for forming soot or forming carbon particles in the environment, so larynx is clear from. So we finished the answer of the question, and now we have another dilemma or another question, which is in some instances we can find a fissure fracture in which is called thermal fracture in the skull of the burned body. So we have a question now: is it an antemortem violence or a thermal fracture? That means if this person is exposed to crime, he was hit upon his head, so is it an antemortem violence, or it is occurring just from fire, which is called thermal fracture? Like this land, which when it is dried, so cracks occur in this land. Like these cracks Cracks can occur in the skull because of the severe dryness from flame. Very hot environment lead to dryness of the skull, or the outer table leads to cracks like the dry land. طيب, how can we differentiate if it is a thermal fracture or traumatic fracture that is antemortem violence? This table can differentiate between thermal fracture and traumatic fracture. So the type of thermal fracture, it is just one type, which is fissure fracture, while the traumatic fracture can have any type of the types of fracture that you have studied in head injury, like fissure fracture, depressed fracture, cut fracture, comminuted fracture, localized depressed, chipped fracture, or any of these types. What about the edges of the fracture? The edges of the fracture here in the thermal one is not displaced. So they are aligned beside each other. But here they are displaced, and I will give you an example now. So there is a gap between the edges. Are there signs of antemortem burn? Yes, there may be signs of antemortem burn, like erythema, like blisters, like the increased level of carboxyhemoglobin. But in traumatic fracture, if he is hit on his head and he is dead, now and he is burned after he is dead, so there are no signs, of course, of antemortem burn. But if he is hit over his head and there is a fracture, then he is still alive and he is burned, so of course you can find signs of antemortem burn here. So that is not a sharply differentiation. About antemortem wound, you can find here in traumatic fracture an antemortem wound over the scalp, which is over the fracture. He was hit, so he has a wound in his scalp and also a fracture in his skull. So this is the difference about the edges of the two edges of the fracture. So here is they are displaced here. You can see a distance, but here no, it is not displaced. This is a thermal fissure fracture, and this is a traumatic fissure fracture. Now we will go to the mechanisms of death and dry burns. This is the table to make the mechanisms of death. So you can see here that we are classifying the mechanism of death in burn according to the onset of death in relation to the onset of burn. So we will classify into four periods. The first one, when death is occurred immediately within the first 6 hours from fire. So if fire is turned on, then death occurred within 3 hours, 4 hours to 6 hours. So it will be due to one of these mechanisms. Let's study them. The first mechanism is neurogenic shock. We have mentioned neurogenic shock because of severe pain from maybe second degree burn. So neurogenic shock is a very rapid and a very immediate mechanism of death. A second mechanism is asphyxia due to inhalation of fumes and toxic gases. So this person is going to asphyxia, which is asphyxia is due to replacement of respirable gas with irrespirable gas. Another mechanism is traumatic asphyxia. Uh, if heavy subjects like subjects from the ceiling or any other subjects are falling over the chest of the body, so that will lead to preventing respiration. So this is traumatic asphyxia. Or if these heavy objects are falling over his head, that will lead to head injury, and this may be an immediate mechanism of death. Okay, and a fifth cause is the rapid edema of the glottis. So edema of the glottis in the glottic area, if edema occurs, that will lead to closure of the respiratory passage, and that will lead to immediate death. Let's move to another period. For example, from 6 hours, so more than 6 hours to 2 days. That is the rapid mechanisms of death. Let's mention 4 of these mechanisms. The first one is the slow edema of the glottis. So we mentioned here rapid edema of the glottis, which will close the respiratory passage and lead to death. Here it may be occurred slowly and for in this period, more than 6 hours to 48 hours. Another mechanism is hemoconcentration, and we mentioned the process of hemoconcentration previously, and that will lead to a chance for thrombus formation, and that is fatal. Another mechanism is hematogenic shock. Hematogenic shock occurred when a burned area happens in the body. Uh, the body now is stimulated to secrete um, so hematogenic shock is due to when a wide area of the body is burned. So the body is responded by secretion of histamine-like substances that will lead to vasodilatation of the periphery. Okay, so blood now is poured in the periphery because of this vasodilatation, and now this is a case of hematogenic shock. So the blood is transformed from the core of the body into the periphery due to histamine-like substances, and these histamine-like substances are secreted for to lead to vasodilatation, to make wash up of these burned areas. Uh, and this is a mechanism of hematogenic shock. Finally, fat embolism is another mechanism of death in this period of time, which is due to if there is burn in fatty area, so fat globules are melted and transformed into fluid state. They can reach the bloodstream, and now they will make an embolus maybe in the pulmonary area and lead to fat embolism. Now let's move to the next zone of time from 2 to 7 days. If death occurred in these days or in this zone of time, that will have another mechanisms like infection. So the body is exposed because the blisters will be ruptured, and the skin now is raw area, so it is exposed to infection, which can lead to septicemia, and that may be fatal, or another type of infection which is called bronchopneumonia and may be fatal also if it is not treated, and also can lead to something called suprarenal hemorrhage. I will mention it later, or inflammation on multivital organs failure. which is like kidney or liver. More than 7 days, which is the delayed mechanism of death, may be due to liver failure. So here the failure starts, and here it is complete liver failure and or renal failure, or may have this person may have a curling ulcer, and I will show you the curling ulcer and the suprarenal hemorrhage in the next slides, and also the edema of the glottis, which I mentioned in the immediate and rapid. Here is the glottic area, and now if edema, it is very narrow area rather than this is a very wide area. So if the glottic area is closed by edema, that will lead to death in case of and this is the explanation of the suprarenal hemorrhage. Why suprarenal hemorrhage occur in a case of burn? Because of the hypothalamic pituitary adrenal axis, which is stimulated by stress. When the body is present in a stress position, now stress is due to burn. The hypothalamus is stimulated. The hypothalamus, when it is stimulated, it will secrete the corticotrophic releasing hormone, which will stimulate the anterior pituitary to secrete the adrenocorticotrophic hormone, which is directed to the adrenal glands. These glands are resting glands, but now in the stress they are acting and they are functioning all the time because of this axis. So now they are secreting cortisol hormone, which will close this axis, but while stress is still present, so the axis is working again. Now these glands are functioning, are acting, vasodilating, blood vessels are vasodilating, so that will may lead to a suprarenal hemorrhage, and this is a mechanism of death. And finally, we have mentioned another mechanism which is called curling ulcer. You can see here these ulcers present in the gastric region or in the duodenal region. Here, why are these causes of the ulcer? So the curling ulcer is an acute gastric erosion from severe burns when reduced plasma volume leads to ischemia and cell necrosis of gastric mucosa. So we mentioned that plasma volume is reduced. Why? Because plasma now is moved to the blisters, and now it is not present, or the bloodstream is poor of plasma, so the nourishment of the gastric mucosa is poor, and that will lead to ischemia, cell necrosis, and maybe also erosion, and this is an ulcer which will lead to severe hemorrhage and death. Now we have finished dry burns with all of its important points. Let's move to scalds, which is another type of burn called scalds or moist burns. So this is a very good example of one of the main causes of scalds, which is boiling water. So we will first define scalds. Next, we can study the circumstances of scalds, and finally, we can mention some of the causes of death in scalds. So first, what is scald? It is a tissue damage from hot liquids, or also don't forget from hot vapor. What are the degrees of scalds? They are as the dry burn, like Wilson degree of scald, first, second, third, but no, there is no third degree in scald, just first and second. So that means erythema, blistering, and also desquamation. Desquamation means After rupture of the blister, we can find that the walls of the blister are present as a desquamated skin, and we will find a photo now. طيب, what are the circumstances of scalds? So where you can find scalds, or what are the circumstances? First one is immersion. Immersion, like when the mother put her child in a pot of water to take a bath for the child. So if this water is very hot, so it is called scald. That is the first circumstances, which is immersion. So you will find a sharp demarcation line between the burned skin and the normal skin, and this is called a child abuse because there is a neglect of this mother. This is the baby, which is put in very nice water, but this one is put in a very hot water for unfortunately, and this is the short demarcation line between scald area and intact skin. The second one of the circumstances is called splashing, when one person is splashing a hot fluid or hot liquid upon another one, that will lead to something called trickle pattern over his skin. That is, here is the point of contact, and so the fluid is poured over the body, leading to something called trickle pattern like this, and this will be drawn over the body by scald. The third one of the circumstances like this, it is very common in our home, like children who pull container of hot liquid over his chest and over his face. So these are the scald areas, the face, the chest, and these are the shadow areas, which is the back and the axilla, and it depends upon the length of the child. And this is also very dangerous position for children. And this is also when this kettle is full of boiled water, that will lead to a scald over her face, over her chest. So some make this shield so to prevent the children from making this position. The fourth one of the instances, which is called industrial accident, where these tubes are full of hot vapor from the industrial products. So when this tube is there is some problem, so it will rupture and lead to very dangerous accident for many of these persons present in this industry. This is a real photo from a textbook about a second degree scald. And this is the desquamated skin. Desquamated means the ruptured blisters. Why I mentioned that it is scald, not dry burn? Because of hair. Here the hair of the leg is just wet, not burned. I will show you now. If it is dry burn, you can see that the hair is coma shaped, or it is clubbed. Clubbed mean that the keratin, which is covering the shaft of the hair, when it is exposed to hot environment, it is melted. Then when it is cooled down, it will be uh, uh, solid again, but it will be in a clubbed manner that is uh, that resembles an unlit match. Or in case of dry burn, the hair may be totally absent, totally burnt, and it is not present. Like the scalp hair, it may be totally burned or totally absent. Now we have reached to the end, which is about the causes of death in case of scalds. We can mention many causes, and we can borrow them from the previous table of the mechanisms of death from dry burn, like neurogenic shock, secondary chest infection, electrolyte disturbance, and that is another cause from the transformation of plasma from blood into the blisters, carrying the electrolytes from the blood, so leading to electrolyte disturbance, and that is fatal. Now we will reach to the last one of the types of burn, which is the chemical burn or corrosive burn. Chemicals may be poured over the skin or over the hand, like these two types of burns, and it also follow the same burn classification for Wilson. They are caused by irritants or corrosives like strong acids, alkalis, detergents, solvents, or cement, like this hand. Or maybe due to the rupture of the airbag, which is present in the car to protect the chest from fractured ribs. But if it is ruptured, it is containing sodium hydroxide in aerosol or sodium azide, and these are corrosive materials and lead to chemical burns. So how can we differentiate between the three types of burn, which are dry burns, wet burns, or moist burns, or scald, or corrosive and chemical burn? About the agent, we have mentioned that this is a dry heat, this is hot liquid or hot vapor, and this is a chemical. We mentioned the difference between both of these for about hair. Hair here is clubbed hair, comma shaved or absent, and here it is just wet. In chemical burn, it is eaten up hair. About clothes, it is a very important physical evidence in all of forensic issues. So, uh, clothes will be burned in dry burn, so they are surrounded by something like soot or carbon particles. In moist burn, they are wet by the same material which leads to scald in the skin, either water, either boiled oil, either coffee or anything. Here, the clothes are eaten up. What about soot? Soot is just present in the air passages of dry burns. What about carboxyhemoglobin level, which we have mentioned before? It is only present in case of dry burns. What about scar formation, which is the disfigurement present after healing of the burn? It is present mainly in dry burns and in corrosion. It is also present in scalds but less formed scar. So we have finished the three types of burns: dry burns, moist burns, and chemical burns. Let's move to the second part of the lecture about electrocution and heat entry. Thank you.